A straw man argument is a fallacy where someone misrepresents or oversimplifies an opponent's position to make it easier to attack or refute. Instead of engaging with the actual argument, the person constructs a weaker, distorted version, the straw man, and critiques that instead. We've seen this throughout the COVID narrative. Ethical doctors and scientists who revealed truths about the vaccines had their character and credentials attacked, rather than engaging them in scientific debates that would have been open to the presentation of data from both sides. Anti-vaxxers, COVID deniers, science deniers, all manner of straw man labels have been applied, but the end result was the same. Question the narrative, and you will be attacked, and every effort will be made to silence you. Because of this, while individual doctors and nurses have spoken out against the COVID mandates, no one has yet conducted a wide-spectrum survey of healthcare workers in Canada on the impacts of those same mandates on the workers themselves and on our healthcare system. Until now. Professor Claudia Chaufin is both a medical doctor and holds a doctorate in sociology. She's an associate professor of health policy and global health at York University in Toronto, and recently she published the results of large-scale surveys she has done of healthcare workers in both Ontario and BC. Even for those of us who have been aware for years of the negative impacts of the mandates, Professor Chaufin's findings are shocking. In her data is the answer to how Canada's healthcare system has so swiftly moved from being one of the best in the world to being one of the worst.
Well,
Claudia, welcome to the show.
Thank you very much, Will. It's an honor and a pleasure, and grateful to be here.
Well, I'm really looking forward to this because I looked at your study. What you've done is you've done a study of healthcare workers and in regards to the vaccine mandates and how this has impacted our healthcare and our healthcare workers. So before we get too deep into the data, would you please just give us a brief summary of the methodology that you used and what you found?
Sure. Well, this is just one of the surveys we've done. Meaning, myself and my small team of enthusiastic research assistants. And I want to give a shout out to them because the work wouldn't have been possible without, not have been possible without them. So I think of it as a mixed method study because it actually started without healthcare workers, but rather looking into the literature about healthcare workers and vaccine mandates and the responses to it. And because I think of myself as taking a sort of a critical perspective on policy studies, and by critical, I simply mean that I do not take the framing of problems for granted as they appear in public discourse and the official narrative. I question those problem framings. I started by looking at that literature, and I concluded that that literature very sort of, I don't want to say intentionally, but it sort of misrepresented the nature of the problem, misrepresented it. And what do I mean by that? Well, it took a very sort of a priori bias perspective on what the problem was without really looking at the roots. So after I did that and, looked at the literature, the expert literature, if you will, on what the problem is with these healthcare workers, recalcitrant, who don't want to take the COVID shots, right? I decided, well, we need the voice of healthcare workers themselves. And so that's launched a series of interviews, and perhaps I will give you a more polished version of what it actually was. The process was a bit of a mess, but kind of looking back, this is what it was. So I started with Ontario, and I was blown away by what we found. And it was way more than I expected. The voices of healthcare workers who replied to our invitation to complete a very lengthy survey, by the way. So you have to really be very involved in the issue to really want to spend that time, right? I myself, I get requests for participating in surveys all the time, and I can't bother, right? I'm just too busy. Well, these people took time off their daily lives that weren't easy to begin with